morning, Enriques. This is Dr. Selecki. Today is September 4th, 2008. This is arthroscopy of your left knee. With you asleep, the left knee felt a little looser again than the right knee did, but there was an end point. It wasn't quite as firm as the right knee. Right now we're looking into your knee. We're looking from your toes up towards your head, and we're just getting started. Since we're looking from your toes up towards your head, the left side of the TV screen is the right side or medial side of your left knee, and the right side of the screen is the lateral side of your left knee. Now again, the patella didn't feel all that unstable compared to the other side. It didn't feel like it was laterally tracking any further, because I know you're getting symptoms up near there where your knee felt like it was sort of popping or buckling to the side. Everything, you see the fluid floating around. When I turn on the suction, you can see some of the small particles coming towards me. There's a little loose piece floating around there. This is a little probe that we stuck in. Everything's quite magnified. The little faint black etchings on this probe are 5mm increments. This is a little cannula, a tube that's bringing water into your knee, and this is synovium, that's inflammation that's come in reaction to some of the damage in your knee. Now underneath your kneecap, if we back up, we'll see the underside of your kneecap, or we'd like to. See the underside of your kneecap here where there's some wear and tear. This is the articular cartilage, some wear there. You have this inflamed tissue kind of being pinched there, probably in response to this defect you can see here in the femoral groove. As you bend your knee down like this, it's that's where you're getting some of the pinching and hanging up in this knee. And if I'm going to have to bring in a shaver right off the bat to start cleaning that away, but you can see how this loose articular cartilage down to a little bit of bone in that area, and we may do a little drilling or a little pick to that area. I'll show you. Hold this for me for a second. Thank you. And this little shaver you see coming in, if I turn on the, I don't have the tourniquet up, so we might get a little bit of bleeding, but we'll see. As I step on the pedal, can you turn my pedal on, please? Or instead of stepping on the pedal, I could use a hand control, and that little window on here spins back and forth, and it has this little blade that goes back and forth. Go ahead and activate. And there's a little blade that goes back and forth, and if I turn suction on, it'll suction that part into the knee. And I'm going to continue to clean out some of this tissue that was getting pinched between the, there we go. They're bringing my pedal back, but between the patella, the kneecap up above, and the femur or femoral groove down below. Okay, white please. Lower. And there we go. So that area is not going to pinch there underneath the kneecap, but what I want to do is we're trimming away some of this loose portions of that flap, those flaps of articular cartilage right in this area. And you'll see that we are down to some raw bone, and just this kind of a smooth transition or bevel it into the articular cartilage that's more intact at this point. And I can spin kind of one direction and another. And so this may continue to kind of break down, and some wear and tear underneath your kneecap in this area from kneeling, squatting, or when you twisted your knee is all what could lead to this area, this problem here. Just kind of cleaning and smoothing that area off is what you're seeing here. And getting the loose pieces off of that. So occasionally people do cartilage transplants if this still bugs you. I might put a couple little drill holes in that to help with some fibrocartilage ingrowth in that area. And perhaps that'll help keep it from spreading into a much bigger lesion. Hard to say for sure. But that'll give you some of the little crackling and some of the discomfort underneath your kneecap that you had before we did this case. And there's a little bit of, you can see a little bit of calcium deposits right there in the articular cartilage, part of the chondrocalcinosis, just a type of the wear and tear arthritis here. And getting a little more of this pinched tissue in that lateral side of the knee where you're having some pain. And so I'm going to keep working on cleaning this area up, and I'll turn it on in a moment. I'll turn it back on to show you some more of what we're doing.